So I wanted to talk about something as patients go through upper cervical care that may be of a little confusion to a new patient. When someone comes into the office after they've had their original correction, the follow-up office visits are to check, is the vertebra in its normal range of motion? And if it is, there's no adjustment made. We call that holding your adjustment. But other times the vertebra is partially out of position, but is not locked. It's still moving, it's out of its normal position, but it's not completely locked under the skull. We call this a misalignment versus a subluxation. Subluxations we adjust, misalignments we leave alone. And so some people are under the false assumption that the vertebra's off, we put it back in position, it's right where it should be, and everything magically disappears. That's not really how it works. So initially, when you have an injury and it misaligns a joint in the upper neck, it tears the joint capsule, which gives the joint integrity. So the joint misaligns, it tears the joint capsule, it gets locked there, and then it heals up, and then the patient ends up in our office 10, 15, 30, sometimes 50 years after the original trauma. We see on x-ray how it's off, we make a correction to put the segment back in motion. Because the soft tissue and the muscles, for that matter, are patterned in this bad position, it's not like you get the vertebra back in motion, just goes right back to where it should be. It just gets put back in motion. Over time, the muscles become more symmetric and the joint over time pulls into alignment. So I wanted to differentiate between what we call a subluxation, which is locked and needs adjusting, and a misalignment, which means it's not where it should be, but it's not stuck. It's still moving. So oftentimes patients will come into the office and they'll say things like this during the beginning of care. You know, like 5 days ago, I knew I was off. My neck was tight, I had a headache, I couldn't sleep that night. And then 2 days later, I woke up in the morning and I felt fine again. And what had happened is the vertebra, from just either normal movement, or they slept funny that night, or they're under stress, that segment's out of position, is partially locked, but it's not completely stuck. And one of the things we'll find on an office visit, if the patient came in the first time and their right leg was 5/8 of an inch, oftentimes when they're partially off but not locked, there'll be 1/4 of an inch on the test, and we'll run them through what we call a chicken neck exercise, which is this. And also sometimes I'll gently have them roll their head in a circle, which puts stress on the joints and movement. And a lot of times that'll help the body correct it. And we'll check them 10 seconds after they did that particular exercise, and that leg that was short is now balanced. So we have a few safety valve tests that can differentiate between when they're misaligned but not locked. And if they're misaligned and not locked, the worst thing you can do is introduce a force into that joint, because at the end of the day, the adjustment doesn't heal anyone. All the adjustment does is get a joint that's locked, which is causing that vertebra not to move how it should and interfering the central nervous system and decreasing your potential. All the adjustment does is introduces force into the joint to get it back in motion. What does the healing is your body. And so over the months, in many cases, years, the body will go through this slow structural straightening process as the muscles become more balanced and the structure comes back into balance. It takes time, and the body does it in the sequential kind of up and down fashion. So as patients go through care, they go through lots of ups and downs, and sometimes they come in to the office very symptomatic, and we run them through the test and find they're not out of alignment. So we only want to adjust people when they're out of position, truly locked, which is impeding the body from functioning as well as it should. If they're not locked, leave the thing alone and let nature do its job. And I'll end this video with my favorite quote with upper cervical. Nature needs no help, just no interference. If we can keep the interference checked out over time, the body's going to go through a healing, mending, and repair process with the end goal of it getting as healthy as it possibly can get.